Hello， 大家好，欢迎来到日视频，我是 Jennifer。美国少数族裔媒体服务中心举办线上座谈会。
Today, our briefing focuses on vaccinating young people between the ages of 12 and 17. Why this has become the next major milestone in gaining control of the COVID-19 pandemic, and what parents think.
Yeah, at our center, we take care of about 27,000 patients. The majority of our patients are Latino working families, with about 10% African American. And for us here, our experience has been that one of the major reasons for lack of vaccination is access to time off from work. Most of our patients work in low income types of jobs, like restaurants and day laborers, and so it is a burden for them to take a day off. They just got back to work, and now they have to juggle being back at work, still having their children at home because they're not attending school, and now having to juggle having to take one extra day or extra half a day in order to come to the clinic and get their children vaccinated. The County of Los Angeles has done a tremendous job in putting up massive vaccine areas, but they all require a car, and most of our patients use public transportation. So that is an added barrier when you can't take time off from work, and then you have to jump on a bus to go get your kid, and then bring back your kid home, and then set up and go to work. That usually takes an entire day to do. So our patients are being asked to basically choose between earning a day's living for the day and or vaccinate their children. So so you can see how that is a tremendous barrier. Now, most of us who don't, who are better off financially and economically may not think twice. We just asked our boss, hey, listen, I want to take a couple of hours off. I'm going to take my kid, I have no problem, jump in the car, take the kid to the clinic and be done in an hour or two. That is not the case for most of our patients. And so by far, that is one of the biggest barriers that we have identified as South Central.
First, I want to just speak to the burden of infection. So there has been a lot of attention that's been paid to our older adult population. However, we haven't really paid close attention to really what's going on with our children. The AAP has been a great source of information documenting that nearly 4 million children have tested positive for COVID-19 since the onset of the pandemic. However, the CDC estimates that when we adjust for underreporting and under-testing that's happening in children, that perhaps as many as 22 million children and adolescents 5 to 17 years have been infected in the US since the pandemic began. It was mentioned earlier that children are now responsible for nearly a quarter of newly reported COVID-19 cases in more recent weeks. And people are asking why, and I agree that some of it is related to the fact that we are reopening, our kids are getting back to school as they need to. But the other reason really is because vaccines have been so effective in protecting the adult population that overall the proportion of hospitalizations reported seem to be increasing in children, but that's primarily due to the protection we're seeing amongst our adults with vaccination.
And we've focused recently in a report I was lead author on earlier this month about what parents' attitudes are toward vaccinating their kids. And what we have found is a substantial gender age gap. More than anything else, the story here is that young moms are highly resistant to vaccinating themselves or their children. And we found back in February that attitudes toward vaccinating yourself really do go hand in hand most of the time with attitudes toward vaccinating your children. So we divided parents into those 35 and younger, or 30 or 36 and older. And so among the younger mothers, we found that roughly a third of them said that they were very unlikely to get their children vaccinated. That's our definition of resistant. Very, when they say very, they have 5 choices from extremely likely to extremely unlikely, and they chose the most extreme unlikely choice. So we say that roughly a third of young mothers are resistant, and that this has not changed since February. In contrast, fathers of all ages are between 10 to 15% resistant. In fact, fathers have become less resistant in the past few months. So father resistance went down from 14% in February to 11%. And this gender gap is particularly important because mothers are the ones who are most involved in making these decisions about their children's health. So there have been a couple studies before the pandemic in New Zealand about why do parents get their children vaccinated or not. And it found that mothers' attitudes had a strong correlation with whether the kid got vaccinated later on, and father attitudes in one study had no effect, and in the other study had sort of a weak effect.